Well, good morning and welcome to this special edition of The Balancing Act. I'm Manuel Hidalgo.
And I'm Olga Villaverde. Today, we're looking back at some of our favorite stories from our rare and genetic disease series, Behind the Mystery.
We're going to meet two inspiring women who confronted the disease head on and overcame impossible odds.
The Balancing Act presents the best of Behind the Mystery, and it starts right now.
First up, we're taking a look back at a rare disease, acute hepatic porphyria, or AHP.
Nicole talks about her long journey to an AHP diagnosis, and Dr. Angelica Irwin, a porphyria expert, provides an overview of this disease, including symptoms and the ways to test for AHP.
Take a look at this.
Before this disease took control of my life, people described me as a firecracker. I was a pilot, I was a world-class skating athlete, and I was just a really outgoing person, just really loved life and embraced it. After getting sick, I just became a shadow of my former self. It took 12 years, countless doctors, and unnecessary surgeries and procedures to get diagnosed. But I refused to give up.
Dr. Angelica Irwin, a member of the Porphyrias Consortium, which is composed of the nation's foremost experts in acute hepatic porphyria, or AHP, tells us more.
Porphyria refers to a family of rare genetic metabolic disorders, and they are classified into either cutaneous or acute porphyrias, depending on the primary symptoms. The cutaneous porphyrias present primarily with skin symptoms, for example, blistering, redness, swelling, and extreme pain of the affected area, and those symptoms occur in the sun-exposed areas. Acute hepatic porphyria, also referred to as AHP, is a debilitating disease that can go along with extreme and severe pain, as well as other neurologic and psychological symptoms. And there are four different types: acute intermittent porphyria, also referred to as AIP. Then there is variegate porphyria, or VP, hereditary coproporphyria, or HCP, and ALA deficiency porphyria. It can take up to 15 years or longer for patients to be accurately diagnosed with AHP, and oftentimes patients are being told that these symptoms may be just in their head. And the reason herefore is that many times imaging as well as lab results may be either inconclusive or normal.
I had just graduated from college and I decided to start my own business, and everything was going really well. And then I started experiencing this excruciating abdominal pain, vomiting and nausea, chest pain. It hurt to breathe. It felt like I was getting stabbed in my chest. Severe back and neck pain. Nodules were found on my lungs. I had extreme weakness to the point of where I needed a wheelchair and I needed help for someone to carry me to the bathroom even. Just so many things that didn't make sense. It wasn't just like, oh, this puzzle fits together. This is what it is. And I think that's why it was so hard to chase this diagnosis.
Because AHP is so rare and its symptoms are similar to other more common conditions, that leads to very frequent misdiagnoses that can lead to potentially unnecessary treatments, surgeries, and hospitalizations. Some of those misdiagnoses can include gastrointestinal conditions, gynecologic disorders, abdominal conditions, or neurologic or neuropsychiatric disorders.
I saw a lot of different kinds of doctors. I saw gynecologists, gastroenterologists, endocrinologists, neurologists, pulmonologists, pain specialists, just kind of beating a dead horse with chasing these symptoms. When they brought up the hysterectomy, I couldn't believe it. I mean, you know, my biggest dream was having kids, so to have to make that decision, you know, was the hardest thing I've ever had to do, and I would have to say it's the most devastating thing I've had to choose in my life. They had told me that this would get rid of the pain. It was the only thing that was going to get rid of the pain, and it was so bad I couldn't live like that anymore, so I had no choice. So I did the hysterectomy, and nothing changed. My life would have been very different if I hadn't done that, but I was just, we were just trying to figure out what it was.
More of Nicole's story in just a moment.
We'll be right back. Well, Welcome back. Let's turn to Dr. Irwin to learn about a genetic defect in people with AHP.
In people with a genetic defect for AHP, one of the enzymes in the heme production pathway does not work properly. In the liver, the heme production pathway is controlled by an enzyme called ALAS1. When a patient is exposed to a potential attack trigger, ALAS1 activity is increased, and the enzyme that doesn't work properly is unable to keep up. This results in the buildup of toxins called aminolevulinic acid, also referred to as ALA, and porphobilinogen, or PBG, in the liver, which are released throughout the body. ALA and PBG are harmful to nerve cells and have been associated with the symptoms and attacks of AHP.
Everyone experiences AHP in different ways. Acute AHP attacks cause severe problems in many parts of the body and often require hospitalization. Chronic AHP symptoms such as anxiety, nausea, pain, and fatigue can occur daily, even when not having an attack.
When a patient presents with an acute porphyria attack, they usually report severe diffuse abdominal pain that is accompanied often by nausea, vomiting, high blood pressure, and tachycardia. These attacks usually last anywhere between 3 and 10 days, and they can be life-threatening if they are severe and not treated urgently. Patients with AHP can also experience effects on other parts of their body, such as tingling, numbness, and limb weakness, chronic pain, fatigue, anxiety, and insomnia, constipation, and diarrhea. Patients can also have cutaneous manifestations like blisters and sun-exposed skin, which only occurs in patients with VP and HCP.
Getting through 12 years of not knowing why I was so sick was beyond frustrating, because you never know what you're gonna get. So to have a job or responsibilities where it's every day, it's very difficult to commit to that. After seeing so many different specialists, I finally saw one that suspected AHP. He ordered a specific urine test to test for it, and it came back positive for AHP. Knowing what it was and being validated that you have something, it's like I was in the dark for years and years. You know, it's hard to keep that hope up for that long. And to have that back has been such an amazing gift. And it just means everything to me.
The first step in diagnosing AHP is to suspect AHP when a patient presents with symptoms. The most definitive technique that the doctor uses to help determine if a patient has AHP is a urine test, which includes analysis of ALA, PBG, and porphyrins. It is recommended to obtain the urine test during or shortly after an acute attack. Once the diagnosis is made with urine testing, genetic testing can then be performed to determine the specific type of AHP. If an individual is found to carry a gene mutation in one of the AHP genes, this information can then be used for family members and if they may be at risk for developing symptoms of AHP. Once a patient is diagnosed with AHP, it is important that they work with a multidisciplinary care team to manage the disorder, since it is affecting various parts of their body. It is also recommended to seek guidance of a porphyria specialist. Patients with AHP themselves should also be aware of acute attack triggers to manage them and avoid them as much as possible. AHP attacks can be triggered by certain medications, hormones, smoking, alcohol, stress, and fasting. There are helpful resources available for patients who have been diagnosed with AHP, such as the American Porphyria Foundation, Global Genes, and NORD. For anyone out there who's experiencing the symptoms, please don't give up, have hope, be your own advocate, and talk to your physician.
After my diagnosis, I was able to find a team of doctors, including a hematologist and a pain specialist, that were able to put a management plan together for me. And I also learned what my triggers are and how to avoid them so I could stay healthy. I also learned to listen to my body, whether it be needing sleep or water or certain foods, and that's helped immensely. Porphyria has affected my life in many ways. It affected the trajectory of my career, and I feel like it stole years of my life. I still have issues, but for the most part, I feel like I'm myself again.
For more information on acute hepatic porphyria, speak to your doctor and visit pinpointahp.com or head to our website, thebalancingact.com.
More Best of Behind the Mystery when we return.
Welcome Welcome back, everyone, to The Balancing Act presents the best of Behind the Mystery.
Next up, NRG1 fusions, genetic abnormalities found in a small percentage of patients with solid tumors.
We're going to hear from Dr. Manuel Hidalgo and a patient who was diagnosed with pancreatic cancer at just 20 years old. Take a look at this.
It's a rare form of cancer that will strike about 60,000 people this year. There's no cure, and researchers don't know what causes the disease.
However, a recent breakthrough is providing answers for people with a rare and specific type of pancreatic cancer. So let's go behind the mystery.
Pancreatic cancer is an insidious disease that took 20-year-old Lee by surprise. It's rare for someone her age to develop it, as men over 65 are generally more at risk.
I was a chemical engineering student in university. I was training for a half marathon, so my life was really, really busy. I started getting symptoms of kind of itchiness, and it was this kind of itchiness that was stopping me from being able to sleep. Like my feet were so itchy, my legs were so itchy. And this went on for about a month before I also started to notice that my eyes were turning this kind of yellowish color. So I decided that I really needed to go into the walk-in clinic, and I pointed out, my eyes are yellow. I don't think this is normal. And the doctor looked at me and said, that's true. Let's get you a blood test. It was at that point that the doctor called me back and told me I should go to the emergency at my local hospital as soon as possible. I was honestly shocked about this diagnosis. I didn't even see this coming.
The Balancing Act traveled to New York City to meet with Dr. Manuel Hidalgo to better understand pancreatic cancer, current treatment options, the importance of genetic testing, and NRG1 fusion cancers.
The pancreas is an organ located in the upper abdomen, around the liver and the stomach, and it has two main functions. One, it produces enzymes, which are protein substances that help with digestion. And in addition, it has another very important role, which is the production of insulin that controls the metabolism of glucose in the body. For doctors to detect a tumor in the pancreas during physical exam is very, very difficult, and usually is not visible or palpable until it's very large and is causing symptoms.
Pancreatic cancer symptoms are often vague and similar to other medical conditions and can include abdominal pain, back pain, unexplained weight loss, loss of appetite, nausea or vomiting, jaundice, and changes in stool. By the time a diagnosis is made, 80% of patients have reached stage 4, and most will die within a year.
Before I got any imaging, the doctors believed that I maybe had gallstones, which is pretty common at my age, I've heard, or even something like hepatitis. They weren't even thinking about this at all. After the CT scan, they also did a biopsy, and I was very scared. I was kind of worried, what's happening? What could be the cause of this? I got the biopsy results. I was there with my parents, and that's when they told me that I had pancreatic cancer. When I kind of looked into pancreatic cancer even more, I was just shocked. This is a cancer that usually affects older people with certain risk factors that I didn't have. And so I was honestly just in disbelief for so long.
For patients who have small localized tumors, we typically do surgery, and that is in general followed by chemotherapy. If the tumor is larger and cannot be operated, we tend to apply chemotherapy and sometimes radiation therapy first. The intent will be to reduce the size of the tumor and then do the resection. If the tumor is too advanced metastatic, the main treatment is chemotherapy alone. So in addition to the traditional treatments, there are now other strategies to treat cancer, such as immunotherapy and molecular targeted therapy or precision medicine. Unfortunately, it's not that common in pancreas cancer yet.
I was really lucky with my diagnosis because the pancreatic cancer was really contained to only my pancreas. So I did choose to do a surgery to remove the cancer and then do chemotherapy to prevent it from returning. For the first year and a bit, I was in remission from my cancer, and so they weren't seeing any tumors. Everything was kind of looking pretty good, and that's kind of how it went for a little while. After one of my routine scans, unfortunately, the results came back poorly and the cancer had returned. And where it was this time, it was pretty much, I was out of options. My only chances here were to choose to do chemotherapy or not, but either way, I was told I didn't have very long to live.
Only between 5 to 10% of pancreatic cancer patients survive 5 years after diagnosis. Doctors are focusing more and more on genetic abnormalities that cause this deadly cancer to try and increase those odds. One of them is NRG1 fusions.
So NRG1 fusions are one of the genetic abnormalities that sometimes we find in cancer, by which cancer develops sort of abnormal growth capabilities. And they're important because they are, when present, they tend to be sort of drivers of cancer growth, and therefore if we can detect them and block them, we have means to treat them. That is a mechanism to control the cancer. We have now different ways to test the tumors genetically. One of them is next generation sequencing. This is a relatively new laboratory technique that allows us to really look very comprehensively to the spectrum of genetic alterations that are present in a tumor, and is becoming widely utilized as we sort of diagnose cancer.
NRG1 fusions are also found in other solid tumors, including lung, colon, prostate, and breast. NRG1 fusions in the pancreas tend to occur in younger patients.
Since I had had my surgery, the hospital had held on to some of that tissue, and so they were able to test that tissue for the NRG1 fusion. So I remember receiving a call from my doctor. We were both actually ecstatic to find out that I had tested and I had had the NRG1 fusion. And I was so excited. This brought in my options for treatment that are more targeted towards my cancer. My doctor told me that I was qualified to enter a clinical trial for an experimental treatment. For me, it kind of felt like I was super lucky in a situation where I had been unlucky to start with. And so for me, this meant that I had a few more options to try and extend my life, to improve my quality of life. And I was just so thankful for it.
Merus, a clinical stage oncology company, is committed to helping patients overcome devastating diseases and close in on cancer. They are developing zenocutuzumab, Zeno, an experimental cancer treatment currently being studied in patients who have solid tumors with NRG1 fusions. Merus is also supporting access to genetic testing for eligible pancreatic cancer patients that may help their physicians better inform them on the possible courses of treatment.
If you're facing a diagnosis of a serious disease like pancreas cancer, it's very important to sort of get information about the disease, and then to seek an appointment in a center of excellence, high-volume centers that have the expertise, the technology to do all these investigations, and also to have access to clinical trials that can be potentially effective against those alterations. There are strategies that can be applied to these tumor types. So we still have a long way to go, but I feel that we're moving in the right direction.
Life today has kind of returned to its normal busyness. I'm spending time with my family. I'm pursuing my master's degree. It was really hard for me to come to terms with kind of how unfair this whole situation kind of felt. But at the end of the day, it's kind of really helped me realize my priorities and put a new perspective on my life, where I just kind of appreciate, especially the people around me, so much more than I ever did before. You know, no one knows how much time we have left, and so we may as well just kind of focus on what we love and just pursue it.
If you're interested in participating in a clinical trial, please talk to your physician and discuss if it's an option for you.
That's right. And for more information on NRG1 fusions, visit nrg1.com, or you can always go to our website, thebalancingact.com.
Thanks so much for joining us today and watching this special edition of The Balancing Act, Best of Behind the Mystery.
Remember to head to our Facebook page and our website, follow us on Instagram, you know how to do it, and go to thebalancingact.com as well.
Absolutely. And we'll see you next time.